Hi, today's workout is about bariatric dental health, the issue no one talks about. I've used material furnished to me by my dentist, David Erickson, who is in Spanish Fork, Utah, and has had bariatric surgery. He's very knowledgeable about this subject. It's kind of a passion of his. So we have found that bariatric surgery, and we know this already, there's a malabsorption issue, or there's a problem with the way that we ingest minerals and vitamins, and that's why we need blood tests regularly. On our teeth, on our dental health, it can cause erosion, it can cause enamel breakdown, it can cause tooth sensitivity. And there haven't been a lot of studies done on the long-term effects, but the short-term effects of 54 bariatric patients after only 6 months post-surgery, 25% of them were experiencing these dental problems. And probably, likely, it's due to the fact that they were not taking their supplements properly or regularly, or they were skipping some of them. They didn't know which ones to take. So this chart here is a great one that lets you know what you need to have healthy dental health. It also helps your immune system, helps your bone turnover rate. It decreases the risk of dental disease. It decreases the risk of osteoporosis and anemia, and it helps with gingivitis and gum disease. So I'd suggest taking a picture of this and checking out what your vitamins have in it and make sure that you're doing okay with this. You'll notice that the percentage of calcium absorbed falls dramatically by 40% post-surgery. And this is due to a reduction in your stomach volume, a change in your intestinal surface area, especially if you've had a bypass. Your pH changes with bypass or with gastric bariatric surgery. And also the gastric emptying is a lot quicker. And so we absorb less because of that. Calcium, as we know, is super important. It supports our bone structure, which we need to be able to maintain a healthy body, be able to move around well without pain. It helps our teeth a ton. And it also helps provide hardness to our teeth and to our bones. When we get osteoporosis, our bones actually become honeycombed and we lose that volume in our bones. It helps protect our gums as well, and that becomes really important. Also, dental health leads to better overall health. If you are a heart patient, you know that sometimes before you go to the dentist for a cleaning, the heart doctor or the dentist or both will ask you to take an antibiotic to protect your heart because of the bacteria that's released through the cleaning. If you've had knee replacement or hip replacement surgery, often the osteo doctor will ask you to take an antibiotic before you go in for dental work, because again, the mouth creates and releases bacteria that can hurt other parts of your body. So keeping your mouth as healthy as you can becomes very important. So what can you do to make sure that your dental health is good? Here are 6 things to keep in mind. First, a healthy diet cannot be substituted. You want to limit your sugars, especially processed sugars. Brush your teeth often if you've had acidic foods and drink. Make sure that you brush your teeth, floss your teeth, do mouthwash and rinses if you need to. Consistency, consistency, consistency. Third thing, having regular dental checkups so they can catch problems early. Be really open with your dentist and hygienist about your bariatric situation, and also some problem areas that you might be worried about, or asking them to keep in mind as they're treating you. I'm really lucky because my dentist has had bariatric surgery. He sat down with me right at the outset of my surgery and has really headed off so many problems that I could have had. The next one is stay educated. What are the best protocols for monitoring not just your dental health, but your overall health? And know what to watch for, know those red flags. Be mindful and consistent in monitoring your vitamin and mineral levels and keeping them in a healthy range. And it's going to be a healthy range for you. Interesting story, I got a call from my doctor after my last blood work test, and she said, your B12 levels are way over range, and so you need to lower them. So I did, I lowered them, and I started breaking out in mouth sores like crazy. Luckily, I had an appointment with Dr. Erickson, who informed me that the healthy range for B12 was not my healthy range for B12, and I needed to go back to my B12 and start taking it again in the amounts I was taking it before. I did, and my mouth sores went away. So knowing what the healthy range is for you. Most healthy ranges are determined by a year's average of the number of people who went in for that particular test. So the healthy range that the doctor was operating from was the average of all the people that went in for blood work for B12 in the last year. And my body need was much higher than that range. So know what your range is, and sometimes you learn like I did from experience. So for your workout today, get out your journal and review the importance of vitamins and minerals and write down your dental plan. If you haven't had blood work done in the last 6 months, schedule it today. And remember to take your supplements, monitor your mouth and teeth for changes, and go back to the slide, what can bariatric patients do to maintain their dental health, and create your plan in your journal and follow it. Remember to notice every day, how strongly do I believe that I can be successful? On a scale of 1 to 10, it needs to be 6 or above, or start working on that one. How motivated am I to be successful? Again, scale of 1 to 10 is 6 or above. What are my resources? Always remember them, because we update them when we meet a new person, when we have a new experience, when we read a new book. Just watching this little video increases your resources. And what are my challenges? Knowing where your challenges are, having a plan for them will give you success. So enjoy and take care of yourself and your mouth and your teeth, and we'll catch you at the next workout.